as the National Health Director, Dr. Horacio Arruda. Mr. Legault, the floor is yours. Hello, everybody. Well, I'm pleased to see you here once again, even if we saw each other at the marché a few days ago during this tour that I was supposed to do, and I will get back to this. But listen, I hope that Quebecers have gone on vacation over the past few weeks. I understand as well that the summer is not over. We had some nice weather last week, and Quebecers don't want to hear about the pandemic, but the virus is not going on vacation. And unfortunately, we can see a situation, especially with the Delta variant. What is happening, especially with people who are not vaccinated, the variant is much more contagious. And when people get it, the chances of going to the hospital are greater. So we find ourselves in a situation where we're not different from what's happening elsewhere in the world. If you look at the situation in the U.S., or in most of European countries, if we do a rule of three, it's like as if in Quebec we had more than 1,000 new cases per day. We are now at 400. So we've gone from 50 and 60 a few weeks ago to 400. So the increase is not as great as in the U.S. and Europe, except that last night, with Christian and Dr. Arruda, we had a Teams meeting with the people from the ENSPQ, and we are unanimous. We must expect in the next few weeks that there will be an increase in cases and in hospitalizations as well. For the time being, hospitalizations went from 60 to 80-something, but experts are telling us that we must expect that there will be an increase in the next few weeks. So we must be honest, even if it's still nice outside, even if we are in the summer, the situation is worrisome, and we must put in place some measures. Of course, I want to repeat this because the numbers are very clear, and people from the ENSPQ have shown this to us, public health as well. We can look at it under several angles, but what we are seeing is that people who are not vaccinated, those are most of the people who find themselves with the virus and who end up in the hospital. So we have some vaccines that work well. The vaccines, we were able to demonstrate with the vaccines in Quebec and throughout the world that it reduces the risk of getting COVID. And if ever we do have COVID, it reduces the risks of having serious consequences that lead to a hospitalization. I want to come back to vaccination. We are now at 85% of Quebecers who have at least one dose. That means that there's a strong buy-in. 85% of all Quebecers, 12 and up. That's quite extraordinary. But despite this, we can see this, there's a fourth wave coming, and Quebec will unfortunately not be spared. And that is why last week I started a tour of the regions of Quebec, a tour that I will suspend because I want to be able to start again with Christian and Dr. Arruda. Unfortunately, we have to explain that we must be prudent, perhaps even more prudent than ever before. And we also have to take into account the fact that in 2 weeks, very soon, we'll be back to school. And it's clear, once again, with the experts, that there will be more contacts. And even if young people are at a lesser risk, well, there's no zero risk, and they can transmit the virus. So we can expect that with back to school, it will increase the number of contacts and so increase the number of cases and the number of hospitalizations. And that is why Christian is insisting so much on the importance, well, those who don't have their first dose, go get your first dose as quickly as possible. And those who don't have their second dose, move it up to before the 1st of September. We really want to do a blitz in the next 2 weeks. Why? Because we must get ready for back to school. and to its impacts on the pandemic. So I'm calling on all Quebecers, please make an appointment or go to a walk-in clinic. There are vaccines available, the staff is there. If ever some people are worried or they're afraid of the side effects, well, you have to know that it's very clear it's much riskier to get COVID than to suffer from some side effects from vaccination. So that's very clear. Go get vaccinated for 3 reasons. First of all, for yourself, because no one can be spared. And second of all, for your loved ones and out of solidarity with the people that you meet in your day-to-day activities. And the third reason, it's to spare our healthcare network. You know, we have some staff who's worked very hard over the past year and a half. We already have some surgeries that have been delayed, so we don't want to have to add to these delays and to add to the burden of nurses and of all the staff in the healthcare network. So think about yourself, think about your loved ones, and think about the healthcare network. Now for masks in schools. As the Minister of Education and the Minister of Higher Learning said, and as is stated in their plan, well, right before back to school, there will be an update of the recommendation from public health, region by region. We don't exclude the fact that the recommendations may be different from one region to the next, except for CEGEPs and universities. CEGEPs and universities, well, there are some students who come from all the regions of Quebec, and there are some students who come from abroad as well. So we can already tell you today that for back to school in CEGEPs and universities, the mask will be mandatory not only in common areas, but even when seated in class. Now, for elementary and high schools, over the next few days, public health will make a recommendation, but I want to be very clear here. If public health recommends that we have masks in classrooms and daycares, we will do so. We will not take any chances. We want to be prudent, but we will look at where public health will look at the situation, region by region, almost school by school, actually. Now, as for healthcare workers, we know that approximately 90% of the staff in the healthcare network is vaccinated, but the 10% that remains, there's a true risk. According to public health, a nurse or another caregiver could, despite the protective equipment, transmit the virus to a patient who is vulnerable. And I understand that this is a decision that is not easy to make, but we will make vaccination mandatory for healthcare workers only. What does that mean? Well, teachers, other employees of the government of Quebec, of the networks of the government of Quebec, for the time being, we don't have the intention of making the vaccination mandatory. It's not a decision that is easy to make. That is one of the reasons why I am coming back to Quebec. Contrary to the vaccine passport, we're making vaccination mandatory will have an impact on 2 things. First of all, on the integrity, the physical integrity. So we're telling people, well, it's not voluntary, now you must be vaccinated. And it also impacts labor laws because we're telling people if you are not vaccinated, you cannot work. So this is not banal, and that is why we spoke with the opposition parties. And as of next week in the Parliamentary Commission, we want to be able to hear different groups, different people. We want to have a consultation, a discussion, a debate on mandatory vaccination, from our point of view, with our proposal, and with the teachers and other employees, state employees who are in contact with citizens. So I'll end by telling you, I understand that this is not the news that we wanted. I would have liked to continue to do my tour of the regions and to meet Quebecers, but the fourth wave is here. It is strong. The Delta variant is very contagious, and there's a true risk when it comes to hospitalizations and deaths. So, once again, I call on you to go get vaccinated, one dose and the second dose. If you know people who are afraid and don't want to get vaccinated, I invite you to try with them to meet a nurse or a doctor, a pharmacist, an expert, so that you can answer their questions and address their concerns. So I want to reassure Quebecers, I'm convinced already that 85% of Quebecers have chosen to go get at least one dose of the vaccine. That is an action that protects in large part, this 85% of the population. Of course, we want the 85% to increase, and we want, of course, to have as few negative consequences as possible. And I'm convinced that together we can get through this fourth wave, as we did for the second and the third waves. So I thank you for your support. I thank you for your collaboration.
Good afternoon, everyone. We're now dealing with the Delta variant, which is more contagious and more likely to bring people to the hospital. The situation is worrying, but we do know that vaccines work very well in preventing people from getting COVID and in keeping people out of hospitals. Vaccination is going well in Quebec, but the number of contacts will increase with the return to school in 2 weeks. So we have to do a vaccination blitz in the next 2 weeks. Please get your first and second dose as soon as possible, but ideally in the next 2 weeks. If you're worried about side effects, take a moment to assess the risk. The risk of getting COVID far exceeds the risk of getting the vaccine. The vaccine is important for 3 reasons: for your health, for the health of your close ones, and to avoid a new wave of hospitalization. Regarding the mask, we'll follow public health recommendation to make it mandatory in CEGEPs and universities. For primary and secondary schools, public health will make a recommendation in the coming days. Public health also recommends making the vaccination mandatory for health workers who are in contact with patients. We'll follow this recommendation. As for teachers and other public servants, it's not our intention for the moment to make the vaccination mandatory. The fourth wave is here. It's more important than ever to get the vaccine in the next 2 weeks. If you know people hesitating to get the vaccine, try to encourage them. We'll get through this fourth wave, together. Thank you.
Merci. Nous allons donc
Thank you. We will now proceed with a question period. We will start today with Alain Laforêt, TVA Nouvelle. Mr. Premier, Minister of Health, Dr. Arruda. Mr. Premier, what will happen to employees who refuse to get vaccinated? Because there will be some. Well, listen, that is one of the things that we want to discuss with the population, with the parties of the opposition. We will give ourselves a certain delay. So the 1st of September for the first dose, 1st of October, second dose. But we cannot afford to keep some staff in contact with patients if they are not vaccinated. So on that end, the recommendation from public health is very clear. Now, they won't be able to work. Will they be paid? Will they be paid partially? These are things that we have to look at and discuss. Dr. Arruda, well, like we discussed this morning, it's the question in CHSLDs and in our institutions. There are some cases, once again. So for us, that's an example. We must make a decision very quickly when it comes to vaccination of healthcare workers. Dr. Arruda, currently, we're looking at the numbers that were published today. And we're asking ourselves some questions. So I would like to have your point of view. 50% of the people who are hospitalized were vaccinated, first dose or second dose, and 26% with 2 doses. What does that mean exactly? Does it mean that the vaccine is not working? Are these people who are at greater risk? Well, the vaccine works very well. It's not perfect, it's not 100% effective, and it's normal when we have an increase in the number of vaccinated people that we find ourselves, when we look at the proportions, with sometimes more people who are vaccinated than not vaccinated. But we have to look at the rate, the incidence of the illness with vaccinated people and the incidence of the illness with non-vaccinated people. So when we look, and you'll see, we will probably publish differently. We'll publish some different graphics that will help us avoid that trap of proportion. So for example, if you've got 90 people who are vaccinated with a rate of efficacy that is X, you'll have a certain number of people who will be sick. But since there are many, many vaccinated people, even if, and the non-vaccinated people, there are fewer of them, but because the efficacy is not great, they're going to have some numbers that could be lower than the other one. But we're going to show you some graphics on this. It's the incidence that we have to look at, not the proportion. What we know currently is that people, the vaccine works to decrease significantly hospitalizations. You'll see the graphic. With 2 doses, it's really at the bottom. 1 dose is in the middle, and no dose at all is at the top. So you have to be careful with the interpretation of these tables. And I will tell you, we'll have one graphic that will be more explicit. You'll truly see the rate of incidence. So how many people who are vaccinated who get ill versus how many people who are not vaccinated who become sick. We can't look at the proportions day to day. Question? I would like to know, what are the jobs that are included in the obligation to get vaccinated and which one are excluded? And what about doctors? You're not the employer of doctors, but doctors can be in direct contact with patients. So is this for them as well? In principle, it applies to any person who is in direct contact with vulnerable people for 15 minutes or more. For example, people who do hygiene or who disinfect a room next to another patient, often they spend more than 15 minutes, so they will have to be vaccinated. It includes the nurses, cardiorespiratory staff. It includes people who have contact with the client that's more than 15 minutes. And the doctor is covered by this as well. Do you have scenarios for the different consequences for people who refuse for whatever reason to be vaccinated? Could it go up to firing them, for example? Well, as the Premier said, there will be some details that will be discussed during the Parliamentary Commission, but we know that depending on the laws, there could be what we call administrative penalties, or it can vary, in our opinion. I'm not talking necessarily about firing people here, but there could be administrative measures that could be applied in situations where the employee refuses a vaccine. Question? I'd like to hear you on the vaccination target. In June, we had the impression that 75 was the magic number and that would give us freedom. Has this target changed? Are you increasing it? Is there a new target that you're announcing today? Perhaps Dr. Arruda can add after, but in the first discussions, when we had set the objective in March, we had talked about 75%, but we weren't talking about the Delta variant either. And I think that Quebecers have well reacted, which means that today, versus when it comes to the first dose, we've surpassed our objective. We're now at 85% as of yesterday. But the big change is the famous Delta variant, which is more contagious, which is more virulent, and which makes people sicker. So I think that through all the discussions that we've had with public health, what we are saying is that we're happy to have reached our minimum, but exactly as the Premier has said, before back to school, before the end of vacation, we absolutely must get as many people vaccinated as possible. Today, I'm telling you that we are among the states or the countries that are most vaccinated in the world with 85%. But if we can, I've said several times over the summer, every additional percentage point means approximately 75,000 people. With every 1%. And every 75,000 people that we reach are people who have a very low chance of going to the hospital or being infected. So that's why for us now, our objective is beyond 80 and 85%, not only for the first dose that we've already reached, but as the Premier said, we must get 80% and more for the second dose. And for that, we just have a couple of weeks left to attain this objective. And if you put it in perspective, what we're missing to reach approximately 80% is approximately 600,000 people. You'll remember that in our best days in the summer, we were vaccinating more than 100,000 people a day. So it's far from being mission impossible. To the contrary, it's just that people who have vaccines that were scheduled for after September, they have to move them up, and people must respect their appointments over the next couple of weeks. And we should be at more than 80% for the second dose within the next couple of weeks if everybody gets vaccinated. Mr. Legault, I'd like to hear you on the suspension of your tour and the message that it sends to federal leaders, Mr. Trudeau in particular. You're suspending your tour. It's not an electoral tour, but his election's in full swing. So is that a way of saying that his priorities are not in the right place? Well, first of all, we have to understand that there are a lot more issues in the provinces than with the federal government. For example, the healthcare network and the education network with back to school. So there are a lot of things that we have to look at and plan and organize at the provincial level, more so than at the federal level. Question? I'd like to hear you on the discussions that you've had with the opposition. I understand that there's a parliamentary commission, but does that mean that the session will be moved up? When will this happen? And in that context, when do you think that you'll be able to make a decision on mandatory vaccination in the health network? Well, we started discussions with the opposition parties, and I think that they're receptive. We are looking, and we're going to see how long and how many questions will be asked, et cetera, per party. What we want is for it to happen next week, and I think that there's a certain urgency to act. And so we would like it to be next week. Now, we have to agree on this with the opposition parties. And this would be done through the Health Commission. And I think that it can get organized quite quickly. On this topic, are we to understand that this is an adjustment following the criticism when it comes to the vaccine passport that was not subject to a consultation? Well, I explained this earlier. For me, there's a big difference between a vaccine passport, where we're talking about non-essential activities, and mandatory vaccination, where we say somebody must get vaccinated, otherwise you can't work. So I think that there's a very big difference between the two. And I think that the question, could not be asked about the vaccine passport as soon as we have a recommendation from public health. But with mandatory vaccination, this will impact the right to work. So it's very different. Question? Gentlemen? Is there a monitoring, perhaps Dr. Arruda, in the next few weeks on political gatherings during the electoral campaign? To respect the sanitary measures, of course. Well, listen, despite vaccination, which is relatively good in Quebec and elsewhere in Canada as well, it's clear that with the Delta variant, which is very contagious, and some people have only received one dose, that we can't leave aside the measures that have been put in place. So the wearing of the mask and the keeping physical distancing, these are the types of things that we will recommend. And I hope that the authorities will lead by example. I know that there have been discussions among some of my teams and people from the National Assembly as it pertains to the measures to put in place. But I will tell you, the Delta variant, and I think that that's why we're insisting so much on vaccination, which is a very important tool. The Delta variant is quite contagious. We also know that in certain situations, people who are vaccinated with 2 doses don't get ill, but they can transmit the virus. There's more and more emerging data on this. So we're not yet back to normal.
Merci.
Question? On the employees of the healthcare network, those who are not vaccinated are already being screened. Are we to understand that now that is not enough and that there are outbreaks or transmission happening and we have to stop this as quickly as possible in healthcare settings? I think it's not enough, the tests. So there are some cases right now. Are there cases? Well, there was some transmission in healthcare settings, and sometimes among employees with certain patients. And remember that our most important indicator in the 4th wave will be the question of hospitalizations. We have a healthcare network that was made more fragile because many people are absent from work because they're either immunocompromised or whatever. So we have to make sure of 2 things: that people do not transmit the illness to the clientele, that's one element, and that they don't contaminate themselves among themselves and that they don't get sick, because we need them to treat COVID-19, but also to provide all the other services, cardiac surgeries, etc. So we must do what we can to avoid this negative impact. Even if there are fewer people hospitalized versus previously, there will be enough, and in younger age groups as well. Question? Hello? Mr. Dubé? For vaccination, mandatory vaccination. For mandatory vaccination for healthcare workers, is that for intermediate resources, RPAs, placement agencies? I imagine that you'll debate it, but what's your intention? The intention is to have all the people who are in contact, as Dr. Arruda said, the people who are in contact for more than 15 minutes with patients, so that includes RPAs, intermediary resources. We want to, yes, ambulance technicians as well. So we'll give you the list, of course, because as the Premier said, we want to be in a parliamentary commission next week. But we want to make sure that we minimize the risks of transmissions. And we know that you have specific objectives. When do you want this measure to be put in place in the network? What's the date? Well, I'll repeat what the Premier said. We have 2 dates of application because we have to remember that in the public network, we have around 91% of people who are already vaccinated. So for the public network, the work is quite advanced, but we have to, well, especially in the private sector, we have to give them a chance to catch up. So the RPAs, the intermediary resources, etc. So we'll ask, for example, the 1st of September for the first dose and the 1st of October for the second dose, to give people the time. We want to discuss with the unions as well. They'll have to help us. We have to understand the questions that the employees will have, but our objective would be to have vaccinated healthcare workers by October. Question? Hello, Dr. Arruda. I'm going to go back to my colleague's question on the vaccination target. We've all heard that there's a light at the end of the tunnel, the sky is beautiful, and now there's all sorts of people who've gotten their second doses and they expected to not have to wear a mask anymore. Among them, university and CEGEP students. When will we get out of this? I mean, we imagine that at some point we'll be able to remove these measures. So what is that target exactly that we need for this? If not, what are the next steps? Are we going to have permanent COVID? Your question is a good one, and I'd like to tell you I would have liked it if this fall we didn't have to do these press conferences, but the Delta variant changed things everywhere throughout the world, and we don't know if there's going to be more variants. I don't want to get into that, but what's clear, you have to understand that we've got a good portion of the population that's under 12 and who's not vaccinated. So that's a group of non-vaccinated people, and that's why there will be some work done on vaccination of younger people to try to make them immune as well, because that decreases the collective immunity when they're not vaccinated. So clearly, you know, vaccines are not 100% effective. There are some people who are not as covered, and we have to aim higher. And my magical number is above 90%. I'm going to be honest with you. I think that ideally 95 would be even better, but above 90%, because we have to compensate the non-vaccinated children by having greater vaccination coverage with older people. And this is a vaccine that was very effective. It's very different than the flu vaccine, where it's 30% effective. We can't compare the two illnesses. But one day we'll get to a certain balance, and we hope that the variants that will appear will look the same. But we already have some questions. Do we need a third dose for people who are more vulnerable or who are elderly? We're learning as we go along. If we just had the variants that we had previously, the UK variant, let's say, we wouldn't be in the same place. But you saw it's not just in Quebec. And I'll tell you, and I want to thank Quebecers, actually. And there's around 5 people who are anti-vax. The others just hesitate for whatever reason. So if you know some people who are hesitated and you're vaccinated, tell them to help them. I think 95% is reachable in Quebec if we really want to be the champions, the international champions. The more we're vaccinated, perhaps people will get COVID, but they won't overwhelm our hospital system, and they won't die from the COVID. It's unfortunate and it's sad, but I've always said that what I tell you yesterday, and you'll remember last March when I was talking about the mask, and I said it's going to change over time. Well, this is still the same thing. I can't give you a guarantee. But honestly, with vaccination, with the vaccination of the younger people, and with a high rate of vaccine coverage with older people, I'm aiming high here, 95%, well, we'll have greater chances, much greater chances of coming back to a normal situation. Right now, those who are the most impacted are the 17 to 24-year-olds. The 17 to 24-year-olds are relatively well vaccinated, and that's good, thank God. Otherwise, it would be terrible. But they will all gather in CEGEPs. So we're adding the mask to see how things unfold, and I think that's a critical period because of the fourth wave, in my opinion. We're increasing. We didn't go up exponentially, but still, I'll tell you quite honestly, I can't wait to see where we'll be in 3 weeks. On the Parliamentary Commission, Mr. Premier, are you open to discussing the vaccine passport during that commission? Because there are some questions that will be asked. I know that in Ontario, there's certain universities who will require vaccination for students. And could that be discussed during this kind of forum? Would you be open to talking about it during the Parliamentary Commission? Listen, concerning restaurants, gyms, theaters, we have a choice. Either we close them or we accept only people who can prove that they've been vaccinated. There's 95% of Quebecers who have received, 85% who have received 1 dose. So I think the question should not be asked when it comes to the vaccine passport, except for a very small minority of people who are contesting its use. However, when we talk about making vaccination mandatory, and affecting people's livelihoods, well, I think that that is debatable. Question? Now, on the vaccine passport, could we, because we're talking about 15 minutes of presence with a patient, when there are visits, could we require a vaccine passport from visitors who come to see a loved one in a CHSLD or a residence? I think that one of the things that we'll have to do is to look, and that's why I think, once again, mandatory vaccination in the healthcare network can be debated during the commission. We'll have to see what we can do with caregivers as well, because you know that that was an issue. I don't want to worry anybody, because once again, we've got 85% of our caregivers who must be who are vaccinated as well, and even more, because in the older populations, the percentage of vaccination is even greater than the average in Quebec. So I don't think that it's an issue. But I think that it's one of the elements that we want to discuss, because what we want to make sure of is that the virus stops circulating in our establishments, specifically our CHSLDs or hospital settings, when people get visitors. So that will be part of the discussions that we will have in the Parliamentary Commission. Joe Biden is supposed to announce the third dose for the elderly. Are we considering that as well for the fall? We asked the question. We should have an answer by the beginning of September. Even in the U.S., they're waiting for the authorization from the FDA. When it comes to the third dose, it's conditional to the FDA's approval. And it will be the same thing here for us in Canada with Health Canada. But the question has been asked. It's been asked. We want to see what are the groups that will get a third dose, what is the necessary interval, and what category. And children? Well, children, that's another element. It's not a third dose, it's vaccination. And vaccination for children under 12. And there were some studies that were submitted by Pfizer to the FDA, so we're keeping an eye on that. Question. Hello, gentlemen. A question with the Parliamentary Commission. You'll talk about the mandatory vaccine for healthcare workers. We'll also talk about education and public servants. Could it be mandatory? Could the vaccine be mandatory for in schools as well, following this Parliamentary Commission? What we are proposing is a public health recommendation. That is that it be mandatory only for healthcare workers who are in direct contact with patients. In the discussion with the other parties, well, we'll hear what they have to say. We'll have a debate. And why not go further right away and say that, and go further than the recommendation, and make vaccination mandatory in schools? With back to school coming, the cases are increasing. If we look in the U.S., a lot of hospitalizations with children. So, Mr. Arruda, why are we not going further? Well, we're trying to vaccine all 12 and ups. We have good vaccine coverage in that category of age. We will see if we must add other measures depending on the epidemiology that we will observe. But to date, I don't know if you understand, but vaccination in schools occurred for students. Teachers were offered vaccination. And I think that, and this is true, I want to say this as well, because everybody says, is it possible? We will continue to do the monitoring to identify where the problems are, because we have to see that vaccinating in a mandatory fashion, well, there are some legal contexts related to the Charter of Rights, where giving somebody a vaccine can limit somebody's bodily integrity. But we do it where we think there's an important threat for everybody's benefit, because healthcare is important. We have to protect our healthcare system, we have to protect our most vulnerable, and we also have to protect our healthcare workers. We'll now go to the English questions.
Good afternoon. A small clarification, perhaps for Mr. Dubé. When you're talking about vaccinating all health workers, can you elaborate on which categories? Do you mean public and private sector workers? Are you able to detail a bit of the list of people that would be obliged to be vaccinated?
In terms of the recommendation that we had from Public Health yesterday on that, it's clear that this is as well for the public and the private sector. And basically the criteria is that it should apply to all employees that are in contact of more than 15 minutes with a patient. That's the general rule, and that includes, in terms of applicability, nurses, all the personnel that will take care. That includes the doctors. That includes every personnel that qualified for that being in direct contact with patient for over 15 minutes. And this is the debate that we want to have in the Public Commission next week.
And for Mr. Legault, Premier, we're back here in this room. We're back in the stage where you are announcing restrictions. It's not over. Does this disappoint you that we're here once again talking about the pandemic?
Yes, it's disappointing, but it's not because we didn't make any effort. At 85% of vaccination, we're one of the places in the world where we are the highest. So we did what we had to do, but unfortunately, with the Delta variant, even if you only have 15%, the variant is very contagious and has major impact on health, which brings an increase in hospitalization, even if you only have 15% of people didn't get the vaccine. So, of course, that's not what was expected a few months ago, but we're not different than anywhere else in the world. And in fact, we're doing better because if you compare with United States and Europe, we would be over 1,000 new cases a day. We are at about 400. So it's better, but still it's high, it's increasing, and experts expect that it will continue to increase in the next few weeks.
Does it disrupt your policies for the fall?
But like I said, first, we will put the mask mandatory for CEGEPs and university students. We'll have a recommendation for primary and secondary school. Also, we propose to have the vaccination mandatory for people working in relation. We didn't expect to do that a month ago, but because of the variant, again, we're not different than anywhere else in the world. We have to take action against the variant. Yeah.
Maybe just to add one point, and this is a statistic that I think is very encouraging to continue the effort on vaccination. At the same time last year, when we were at the beginning of the second wave, for the same 6 weeks that we have monitored in the last 6 weeks, we have, because of the variant, we have 11% more cases this year than last year. We have 60% less hospitalization and 90% less death. So vaccination works, and this is very critical that each time we can vaccinate somewhere, we get the benefit of the vaccination, and we get less people in hospitalization and less people that would die from COVID. So we need to continue vaccination.
Cathy Sonnet, CBC News.
Premier Legault, the Ontario's Chief Medical Officer of Health explained that he's not making mandatory vaccination to healthcare workers and education workers, but almost mandatory. Quebec is going further for healthcare workers. You want to have a debate. I have the impression that as a former manager, you know what it's important what you're asking workers now. This is why you didn't want to be by yourself taking that decision.
No, I can understand that to put vaccination mandatory is something very strong because it means that if you're not vaccinated, you cannot work in the healthcare system. So it's very important. But at the same time, the recommendation of public health is clear. There's a risk. There's a risk for vulnerable patients. So we have to take the balance. Of course, it's hard for the workers, but we have to protect patients.
At the same time, people at home will probably have this question: why you're not making mandatory vaccination for teachers and daycare workers, because kids will be back soon.
Okay, but I don't want to answer for Dr. Arruda, but it's clear that the risk is a lot lower for children than for older patients. So we have to take that into consideration also, the risk for the person in front of you.
Kids are not as risk as elderly people and in hospitals, and we need care workers to make the system work, you know? What will happen if we cannot keep emergencies open because there is no more people because they are sick of COVID-19? There is some healthcare workers who are at home, actually. They cannot work because of COVID. They are immunocompromised and everything. So we need that workforce. If we don't do what is the best, and we did promotion, and I think some will get vaccinated. It's just because they did it before. I think we can get 95% of those healthcare workers vaccinated. I'm almost convinced on that. But as there is a fourth wave, as our system is fragile, we don't want to take the risk of having problems, not being able to care population.
Raquel Fletcher, Global News.
Good afternoon. On the vaccine passport, I'm wondering if you can explain how it will be applied to tourists in the province.
Yeah, what we've asked, we're looking at two alternatives for tourists, people from Ontario. First, there could be a way through what is the new application called ArriveCan. People could, through their ArriveCan, when they arrive in Canada, they could log in to make their passport that they have in different countries being transferred to us. So that's one way of looking at it. And the second way, we have initiated the discussion for people to ask, to go, for example, in the center of vaccination here and ask for the QR code. So those are the two things that we're asking right now. I was told this morning, and this is will be in place for September 1st, because that's the date of application of the passport. The one thing that I would add, and this is not directly in your question, but we had that question 2 weeks ago for people that don't feel comfortable getting the QR code on their phone. They would like to have a piece of paper that is maybe more manageable in their purses or in their pockets or in their wallet. So we will offer a version in paper, but that is smaller, the size of what you need to put in your wallet. And I think that would be very practical for people that don't have a phone. So this is something that we're doing right now also.
And can you explain again in English why the vaccine passport isn't being applied to CEGEPs and universities, why you've decided to make the mask mandatory instead of a vaccine passport for those?
It's a question of, is it an essential or a non-essential activity? I think you cannot compare a restaurant with a university.
Essential? Sorry, I didn't catch that.
It's essential to go to school, yeah.
Okay. If I can just ask quickly your reaction to the swastikas that were vandalized on the Liberal MP's election posters in Outremont.
I didn't hear about that,
There were swastikas, okay.
so I'm sorry.
CTV News.
Mike, can you just tell us when will the mandatory vaccine for the healthcare workers be in effect, and what happens, what will be the consequences if they do not get the vaccine, if they do not want it?
The Premier has said there's two things. The dates that we have in mind, but again, that will be discussed in Commission next week. The date will be that people that don't have a dose yet should look into not later than the September 1st. and the second date would be for the second dose would be October 1st. So they would need to be vaccinated by October 1st, fully vaccinated, or adequately vaccinated, as we call it. So that's the first point.
And if they do not want it?
Well, but this is what we're going to be discussing. Premier has been very clear. We don't like doing that, but I think given how serious is the variant, I think we will have, we'll call them administrative measures that will be put in place, but those are the things that we'll discuss next week.
Yeah, and we've reached the goal that you set of the number of people vaccinated in Quebec, or we're reaching it. We see the Delta coming in strong. What's coming next? Like we saw that the U.S. They're moving ahead with a third dose booster shot. Is this a thing that we want? Is this the solution?
I think there is not one solution. There is a combination of solutions, but I would say that we ask our we ask our Comité d'immunisation du Québec to look at what are going to be the indications of vaccines, like a third dose, and also the vaccination of the kids under 12 when it's going to be available. We are preparing for that, to do it as soon as possible as it is authorized. And there's going to be probably still some general measures taken, like wearing masks, and we will follow the epidemiology. You know, that's going to be if there is some problems in certain specific places, we could add some measures.
C'est ce qui me fait un point de presse. Merci à tous.
Merci.
Combien d'employés de la santé, savez-vous?
On regarde l'ensemble de la population du réseau de la santé,
Ouais.
de façon générale, c'est 500 000 personnes.
OK.
Puis en ce moment, quand je vous dis particulièrement du côté public,
Ouais.
on parle d'un taux de vaccination de 91 % en ce moment.
91 pour les deux doses. Mais c'est...
Vous disiez 50 000 personnes?
Ben, en fait c'est ça. C'est ça.
Ouais, c'est juste
Oui,
une
voilà.
question de-
Lorsqu'on parle d'adéquatement vaccinés, alors donc, si vous faites le calcul peut-être rapidement, pour le groupe public, on parle d'à peu près 50 000 personnes qui ne seraient pas vaccinées, mais à tous les niveaux.
OK.
Mais après ça, il faut rajouter les gens qui sont dans les RPA, c'est pas dans le 500 000, ça fait que c'est beaucoup de...
OK.
C'est bon?
Merci.
Il nous reste...